Without these subsidies, we would be in a much different situation.
Continuing coverage now on what appears to be the primary reason Congress can't get together on a budget, and that's health care. Democrats want to expand programs under Obamacare or the Affordable Health Care Act, and Republicans don't.
Fox 17 News' Karen Aguilar explains the impact it would have on Tennessee hospitals and patients.
The CEO of Ascension St. Thomas says hundreds and thousands of Tennesseans will be impacted if Obamacare subsidies end. The Tennessee Hospital Association tells me the more people walk through their hospital doors uninsured, the more it'll cost facilities. Hospitals across Tennessee will face a burden if Obamacare subsidies are not extended by the end of the year. That's according to the Tennessee Hospital Association. Those tax credits were given to people during the COVID-19 pandemic so they can't afford health insurance. Roger Dunn and his wife rely on those tax credits. He has a family of 4.
They've definitely helped us tremendously.
His family's fate hinges on the decision of lawmakers in Capitol Hill. Currently, Republicans want to thin the budget. Congressman Andy Ogle says in part, the COVID subsidies are costly and were intended to be temporary. This hurts taxpayers. Democrats are pushing to broaden health care. This debate is a central issue of what is causing the government shutdown. Dunn wants to set the record straight.
I know my family, we're not out there trying to get handouts.
Analysts at think tank KFF say some premiums would more than double if tax credits were not extended. What would the impact be to you and your family if the Obamacare subsidies were to end?
To be quite honest, it would be a choice of maybe whether we put food on the table, whether we choose not to go to the doctor.
If patients are not insured or underinsured under federal law, hospitals have to treat them in emergencies. The Tennessee Hospital Association says there is already $1.4 billion in unpaid charity care annually. And with more people insured, the amount of unpaid care hospitals and other providers must absorb is reduced. The spokesperson adds, if those subsidies expire, it would increase the amount of unpaid care delivered. Congressman Ogle's spokesperson says the uninsured have access to health care. Republicans are saving taxpayers money by allowing a temporary COVID subsidy to lapse. He says insurance companies are scamming the hospitals who make it big on Democrat corporate welfare. According to Politico, the U.S. Senate Majority Leader, who is Republican, is open to negotiations on extending the tax credits, but not while the government is shut down. Reporting in Nashville, Karen Aguilar, Fox 17 News, your Code Red station.